Right on to this now. So 5 years after the COVID-19 pandemic caused global lockdowns, economic turmoil and millions of deaths, World Health Organization member states have agreed on a draft pandemic treaty outlining how the world should respond to future health crises. Now, the proposal aims to strengthen global collaboration on prevention, preparedness and response to future pandemic threats. To help us unpack this further, we are joined by Ghanaian Medical Doctor, Dr. Hannah-Lisa Tetteh. Dr. Hannah-Lisa Tetteh, good afternoon. Thank you so much for joining us. Before we actually get into the work that's been done by the World Health Organization with this pandemic treaty, I think it's also an opportunity to look back at 5 years ago, certainly the lessons that we are reflecting on now, 5 years later, about the lack of preparedness and certainly not having protocols on understanding a pandemic. So perhaps you've got some reflections from your own country in Ghana, what 5 years ago would have looked like for you as we compare them to other parts of the world and here in South Africa. But those big nuggets that stand out for you about the lessons that 2020 taught us about preparedness.
Well, thank you for having me. We don't want to go back to thinking about it, but of course, as we reflect on the lessons as well. COVID-19 was scary. Even the name initially, there wasn't a name. The name came later on, and that was the first scare. We didn't know what was happening. Everybody was concerned. People were looking up to health officials, asking us what's going on. Today, the WHO says we should do this. The next day, they come and say, no, we shouldn't do this. They told us that it can be spread through touching surfaces. Then they came back and said, no, now our research says it is through droplets. So it was quite scary for everybody, and it was unsettling. Then, of course, there was a lot of misinformation, and then there were those who lost faith in the health officials because we would come up with different things. So even when we're sure of our information and we're giving them, they didn't believe it anymore because to them, we'd made so many mistakes initially. And then also people wanted to believe that it was something restricted to people from a particular place. So because it was found in China, then of course, it started in China, then of course it's limited to the Chinese, and then Africans are not that affected. Then of course the conspiracy theories came up. It was a difficult time for us, a difficult time for health officials. It was a difficult time for the government as well, because everybody was looking up to them. Are you going to do the lockdown? Are you not? Then the government was also thinking about the economic implications of the lockdown. Yeah. If people who have a daily source of income by going out are being asked to stay at home, then what's going to happen? The government has to feed them. The government didn't think they were economically ready for that. So some people did the long lockdown. In Ghana, we did it for only 2 weeks. When there was a lockdown, everybody was hailing the government. After 2 weeks, when they came back and they said, no lockdown, people were like, are you really sure that no lockdown? The scare was still there. It was difficult for enforcement agencies because the police and then enforcement agencies were supposed to go out there and ensure that people were inside. So they also started complaining about their safety. Yeah. Then in the health fraternity, we lost so many people. And so people were scared. Yeah. Health workers were overworked. We could see our friends dying. What was being done to us? There were some incentives that were given to us, but most of our family members were calling us and saying, come back home, come and sit at home. I mean, no incentive is worth your life. So then you're thinking, do I go out and save life? Or do I come and sit at home and save mine as well? To be safe, it was a challenging time. Yes, it was really a challenging time.
You know, Dr. Hannah, you talk about what it looked like in Ghana, and I can tell you here in South Africa, it doesn't sound very different. I can tell you that. It was a terrifying period. And I suppose because of that, then you've got the World Health Organization that says, all right, well, let's bring countries together and then put together a treaty that says, should we encounter as the world yet another pandemic, what are the steps that we then take? And what's particularly interesting is that you've got, for instance, the leadership of the WHO, Tedros Ghebreyesus, who says he's heralded, he said it's in a historic moment, and he's quoted as saying, "In our divided world, nations can still work together to find common ground and a shared response." But here's what's particularly interesting. You've got, for instance, the United States that has pulled out of the World Health Organization. So how united, in your view, is this treaty and this plan of, nations globally knowing collectively what, the steps to take are when we've been hit by another pandemic?
So I think the thing is we have to start somewhere. Some people would agree, some people would not, but at least it's worth a start. The thing is, the countries that have pulled out, like America, it's going to be a challenge because during COVID, of course, they were very, very instrumental in research and development of vaccines. And of course, we know how much they contribute to the World Health Organization. They are one of the largest, if not the largest contributors. And of course, we needed money to fight COVID. So that, yes, is essential. Then the Argentinian president too has pulled out a few weeks after that because of profound differences. So we have people who don't quite agree with the World Health Organization, but at least it has a 194 member state. So we need to start from somewhere. There were challenges during COVID. The challenges were that so countries would give samples, and when they give samples, they don't receive the results of the testing, they don't receive medication, and then they don't receive vaccines. So then they felt like they were being cheated. Why should I give you samples and then you're able to do research on it and I don't get anything from it? So people stopped giving their samples to the World Health Organization. So one of the ways to deal with this was that WHO is supposed to keep about 20% of vaccines such that poorer countries can get it. And then in the treaty, if you give samples, then you are entitled to medications, you're entitled to results on the testing, and then you're entitled to vaccines as well. So that's a step in the right direction. We also had vaccine nationalism. Of course, the countries that are richer were fighting for their citizens. So some of them went behind the WHO, and then they spoke directly or dealt directly with the pharmaceutical companies, such that all the vaccines were given to them to vaccinate their countries and get herd immunity before other countries were considered, which is not ethical because health shouldn't be based on finances, or it shouldn't be based on financial or economic strength. Yeah. So that's one of the things that is going to be dealt with by the treaty. There's going to be some vaccines and medications in terms of an outbreak or a pandemic being kept by the World Health Organization so that poorer countries do not suffer. The pharmaceutical companies, of course, they're in business. So we just appeal to their ethics. It's not ethical for you to do that. But then again, they would also argue that if I don't have money for research into medications and somebody gives me money into research into these medications and the person is asking for these medications after he has funded it, what do I do? So those are some of the ethical concerns as well. And then also in the treaty, there's a discussion on how to manage some disagreements that may occur. Yeah. So you see, Argentina says that they have profound differences with the World Health Organization. Some countries don't believe that they deserve to, the poorer countries deserve to be supported. Some countries think they should serve their citizens first, and when their citizens are done before they serve other countries as well, or they help other countries. Now, how are African countries also going to place themselves in positions where they are able to stand on their own? How is their research going to be funded? How is their medication going to be supported? How are their health systems going to be supported so that when there's an outbreak, they will be able to manage it? So these are some of the things that were addressed in the treaty. Yeah.
One of the other things as well was the time at which countries are able to report dangerous new outbreaks that I believe has actually become quite a contentious issue for some African countries that do not disclose to other countries as quickly as possible when they do see an outbreak.
Yes, but you can't, in as much as we are entreated, or it's even in international laws that you report an outbreak immediately, you can't blame them to. See what happened to South Africa when you reported the COVID, the new variant, and then it was like they placed a ban on you. So next time, would you report it? No. So people are scared because of stigmatization. Some countries are scared to report these things because it affects not just their health. It affects tourism as well. Now, nobody's coming to your country because they are scared. Even after the disease is gone, so many people are scared to come and do business and trade with you. So there are lots of factors to consider when it comes to this as well. But then it's ethical, and then even we are bound by it. It's legally binding on countries to report outbreaks as early as possible. But everybody has faulted. Africa faulted when there was Ebola. The Chinese faulted when there was COVID-19. And America has faulted in their flu pandemic as well. So,
Okay, so final question, because you did touch on the issue of access to vaccines and lessons that we take out of COVID-19, and then of course to deal with that, you've got the WHO saying that where in the future, this is part of this treaty in the plan, is that once we start to understand an outbreak, you would then have the WHO holding 20% of all products for the sake of poor countries. 20%. Is that enough?
It's not enough. But the poor countries don't have money to contribute towards the research. So at least it's just to ensure that they have something. They have something such that it's not like the vaccine nationalism is not as bad as maybe a country having 100% of it. Now the WHO has enough to distribute. And then we rely on donor agencies and then benevolent agencies or individuals as well to support financially. But I think that in all of this, there should be a wake-up call to Africans. How are we supporting ourselves? How are we empowering ourselves such that we don't always have to depend on the stronger, economically or financially stronger nations? These are the lessons that we need to take from COVID as African countries. We need to empower ourselves. We need to put in structures. We need to put in structures such that when there's an outbreak, we won't have to wait for the richer countries to support us financially.
And just one final one, I suppose, as we reflect back on that entire treaty, I'm going to put you on the spot here a little bit, Doctor, if you'll allow me, and that is, well, how would you rate it? If you were, would you say that it's mildly good as a treaty, a good starting point? How would you describe the quality of the treaty that's been put forward by countries within the WHO?
I think it's a step in the right direction. It may not.
Okay, frozen there, but she does say the treaty, the pandemic treaty put together by the World Health Organization in the member countries, saying it is a step in the right direction. Dr. Hannah-Lisa Tetteh there, speaking to us from Accra in Ghana. She is, of course, a Ghanaian medical